Food allergy versus intolerance. What is the difference? I answer that question in this video, so stay tuned. Understanding the difference between a food allergy and an intolerance can be confusing, so I'm going to explain right now how to distinguish the two. Let's start with food allergies. Food allergies affect around 5% of adults and 8% of children, and these numbers are rising. A food allergy is a condition in which certain foods trigger an abnormal immune response. It's caused by your immune system wrongly recognizing some of the proteins in a food as harmful. Your body then launches a range of protective measures, including releasing chemicals like histamine, which causes inflammation. For people who have a food allergy, even exposure to very small amounts of the problem food can cause an allergic reaction. Unlike an intolerance to food, a food allergy can cause a serious or even life-threatening reaction by eating a microscopic amount, touching, or inhaling the food. Symptoms can occur anywhere from a few minutes after exposure to a few hours later, and they may include the following: swelling of the tongue, mouth, or face, difficulty breathing, low blood pressure, vomiting, diarrhea, hives, or itchy rash. In more severe cases, a food allergy can cause anaphylaxis. Symptoms, which can come on very quickly, include an itchy rash, swelling of the throat or tongue, shortness of breath, and low blood pressure. In some cases, it can be fatal. Interestingly, although it's possible for any food to cause an allergy, 90% of food allergies are caused by just 8 foods: peanuts, tree nuts such as walnuts, pecans, and almonds, fish, shellfish, milk, eggs, soy, and wheat. So that's the lowdown on food allergies. Food intolerance, on the other hand, is a digestive system response rather than an immune system response. That's the key differentiator versus an allergy. It occurs when something in food irritates a person's digestive system, or when a person is unable to properly digest or break down the food. Intolerance to lactose, which is found in milk and other dairy products, is the most common food intolerance, affecting about 10% of Americans. Causes of food intolerance include absence of an enzyme needed to fully digest the food, lactose intolerance being a common example, irritable bowel syndrome. This chronic condition can cause cramping, constipation, and diarrhea. Sensitivity to food additives like sulfites, MSG, or artificial colors. For example, sulfites used to preserve dried fruit, canned goods, and wine can trigger asthma attacks in sensitive people. Celiac disease. Celiac disease has some features of a true food allergy because it involves the immune system. Symptoms often include gastrointestinal issues, as well as those unrelated to the digestive system, such as joint pain and headaches. However, celiac disease is not life-threatening. This chronic digestive condition is triggered by eating gluten, a protein found in wheat and other grains. Symptoms of food intolerance include nausea, stomach pain, gas, cramps or bloating, vomiting, heartburn, diarrhea, headaches, and irritability or nervousness. While many food intolerance symptoms are often mistaken for food allergies, remember that food intolerance never involves the immune system. This means that while they can severely impact the quality of your life, they are not life-threatening. If you have a reaction after eating a particular food, see your doctor to determine whether you have a food intolerance or a food allergy. If you have a food allergy, you may be at risk of a life-threatening allergic reaction, even if past reactions have been mild. Learn how to recognize a severe allergic reaction and know what to do if one occurs. You may need to carry an EpiPen for emergency self-treatment. I hope this video clarified the difference between a food allergy and an intolerance. Please hit that like button to let us know you enjoyed it. Comment below with your feedback. We'd love to hear it. And be sure to subscribe for more health and wellness videos here on Nested TV. And remember to stay happy and healthy. You may need to carry an You may need to carry an emergency, oh man, I can't, epinephrine? EpiPen. It says EpiPen. EpiPen?